during this second half of the cycle is progesterone. Please remember, progesterone in low concentrations has a positive feedback on LH and FSH. But in high concentrations, it has a negative feedback on LH and FSH. It is the follicular phase time duration which can vary. But the time duration of the luteal phase is always fixed to 14 days. So now, next question, set of questions they can ask you on corpus luteum. They can ask you, corpus luteum in a non-pregnant female is maintained by, it is maintained by LH. Corpus luteum is formed only because ovulation happens, and ovulation happens because of the hormone LH. Same function in pregnancy is done by HCG. If they ask you what is the lifespan of corpus luteum in a non-pregnant female, that is 12 to 16 days. And which hormone prevents luteolysis? The hormone which prevents luteolysis is HCG. Please do not say progesterone, it's HCG. Maximum size and maximum activity of corpus luteum it is seen on? It is seen on 8 days after ovulation. And if ovulation is happening on day 14, that means it is seen on day 22 of the cycle. And that means maximum progesterone is seen on day 22 of the cycle. That means because whenever progesterone is maximum, it has a negative feedback on LH and FSH. So minimum LH and FSH is seen on day 22 of the cycle. Now, if an infertile couple come to me and I want to know whether the female is ovulating or not, I have to check the levels of progesterone. And that means the tests for ovulation, they are done on day 22 of the cycle. Either I can say that they are done on day 22 of the cycle, or a better answer will be 1 week before menstruation. Right? These are important questions on corpus luteum. Now, next very important point is the day of ovulation. How do you calculate the day of ovulation? Day of ovulation should be calculated as 14 days prior to the next cycle. Right? So it's 14 days prior to the next menstruation, or from the length of the cycle, you have to subtract 14 to get the day of ovulation. So suppose if your question comes that there is a female whose cycle length is 40 days, when will she have ovulation? So 40 minus 14, which is day 26 of the cycle. Now please remember, some females, they may have pain at the time of ovulation, which is called as Michel-Merz syndrome. Michel-Merz syndrome. And in Michel-Merz syndrome, patient is going to complain to you of mid-cyclical pain in abdomen every month. Now, what do you call as pain at the time of menstruation? Pain at the time of menstruation is called as dysmenorrhea. Please remember, dysmenorrhea can be of two types. It can be primary or it can be secondary. Primary dysmenorrhea is because of the withdrawal of progesterone. Progesterone is a smooth muscle relaxant, so whenever progesterone is going to withdraw, that is going to lead to vasoconstriction, and that is going to lead to release of PGF2 alpha. And it is this PGF2 alpha which leads to pain at the time of menstruation, and this type of pain is called as primary dysmenorrhea. On the other hand, if pain is happening because of any pelvic pathology, then that is called as secondary dysmenorrhea. In primary dysmenorrhea, there is no pelvic pathology responsible for the pain. So the question can be asked that what is the most common cause for secondary dysmenorrhea? Most common cause for secondary dysmenorrhea is endometriosis. Right? Other causes can be adenomyosis, or it can be a fibroid, or it can be PID, or it can lead to secondary dysmenorrhea. Questions of primary and secondary dysmenorrhea are very, very often asked. Now, the patient profile is very different in primary and secondary dysmenorrhea. In primary dysmenorrhea, you will have a young girl who will come to you and she will say that she has pain since menarche except for the initial few cycles. Why initial few cycles? Because initial few cycles are anovulatory, and anovulatory cycles are always painless. Please remember that. Right? Or in case of secondary dysmenorrhea, you will have a reproductive age female coming to you. In other words, a female who is more than 30 years. She will say that till now she was not experiencing any pain during menstruation, but from now she has started, very recently she started having pain at the time of menstruation. In case of primary dysmenorrhea, pain is going to be